Hello everyone, this is Dr. Shameem. I am proctologist, breast surgeon and general surgeon. Today we will discuss about pilonidal sinus. Pilonidal sinus is a benign disease which is very commonly seen in males but also seen in females. So what is pilonidal sinus? Pilus means hair and nidus means nest. That means a sinus which contains hair and nest is called pilonidal sinus. It most commonly appears between the two buttocks, in the cleavage between the buttocks. But it can also occur in other parts of the body, especially in females. It can appear between the two breasts, cleavage between the two breasts. What are the reasons for formation of such a pilonidal sinus? One is obesity. Because of obesity, there is a deep cleavage which leads to sweat accumulation and formation of these pilonidal sinus. What happens is initially there will be an infection of the sweat gland which leads to sucking up of the hair inside that gland because of the friction whenever we walk. And so this forms a pilonidal sinus initially. After infection, it becomes an abscess, and this in turn turns into a pilonidal sinus tract, where one of the end opens up on the skin and pus starts to ooze out from that opening. So once such a tract is formed, there can form many multiple branches also to such tracts. So what are the risk factors for getting pilonidal sinus? So first is obesity, being obese. Second is having a sedentary lifestyle, that is sitting in one place for a long time. Third is male gender, but it is also seen in females. Fourth is keeping the place unhygienic. So these are the four reasons why we are prone to get a pilonidal sinus. So let's see what are the symptoms of pilonidal sinus. So once we have pilonidal sinus, there will be pain, swelling and pus discharge from that area, that is between the two buttocks or between the breast cleavage. So there will be pain, swelling and the pus discharge oozing out from the swelling. These are the most common symptoms, and sometimes even the hair can be seen coming out of the opening. Coming to investigations, once you experience such symptoms like pain, swelling or pus oozing out, you have to show a doctor, and doctor will clinically see and diagnose whether it is a pilonidal sinus or not. For confirmation and to know the depth and the length of the tract, we usually perform an ultrasound examination. In ultrasonography, we get to know the tract length, depth and if any there are branches, and also if there is any other connection. If we are suspecting any connection to the bowel, we usually prefer an MRI. So MRI and ultrasound of that area are the most common investigations we advise if we suspect it's a pilonidal sinus. Let's come on to the treatment. So main treatment option is surgical. There are very less chances that it can get resolved with only medication because the tract is filled with hair and there is infection inside the tract. So the main option for this is surgical treatment, and there are many options in surgical treatment like surgical excision followed by flap placement, and also the recent advances in the pilonidal sinus treatments including the lasers. So if you experience any of these symptoms, and especially in the intergluteal cleft or between the breast, the cleft, kindly consult your doctor for further examination. Thank you.